In our first half hour, we looked at Iowa politics, and now we are turning to Springfield. We are rapidly approaching the end of this year's legislative session in Illinois, but while lawmakers continue to work on reaching a budget agreement, immigration has been making headlines in the state. U.S. Secretary of Homeland Security Kristi Noem was in Springfield last week to protest the state's sanctuary status. Now, she claimed Illinois gives free health care to immigrants. But a new study from the University of Chicago suggests there's a benefit here to Illinois hospitals. There's a lot to get through. So joining us now to break this all down is Peter Hancock, State House reporter for Capitol News, Illinois. All right, Peter, preliminary reports from this study seem to show that these two state-run programs, which do give Medicaid-like health care expenses to non-citizens, are actually financially helping Illinois' hospitals. What's going on here?
Well, the studies, as you said, were done, and it's an ongoing study, and so we're just looking at sort of preliminary results. But I think they wanted to get these numbers out because the state and Governor Pritzker is actively considering shutting down one of these programs. That's the Health Benefits for Immigrant Adults, HBIA. It's for people aged like 42 to 64. Um, and it covers quite a few people. What they're saying is that there's a relationship between these programs and reducing the amount of uncompensated care that hospitals give out. And they said that on average, hospitals in Illinois saw about a 15% reduction in their bad debt or uncollectible debt from uncompensated care they give out. And they looked not only at hospitals in Illinois, but also in neighboring states of Indiana and Wisconsin, which do not have the same programs. They looked at them over the same period of time and used different timing scenarios. And basically, they're saying that this has helped the bottom line of hospitals. Now, it's worth noting that there was an audit earlier this year from the Auditor General of the state who said that these programs actually cost much more than anybody was anticipating when they first passed, and that for the first 3 or 4 fiscal years of these programs that started in 2020, the state had spent about $1.6 billion. I don't know that there's been a $1.6 billion benefit to hospitals. They ended up covering a lot more people than they expected. Some of the people, there are questions about whether or not they were really eligible to be in these programs. And anyway, as part of a budget balancing maneuver, Governor Pritzker is proposing to shut down one of these programs that serves basically working age adults, 42 to 64. There would still be a program for seniors age 65 and over.
Well, Peter, I want to stick with health news and turn to autism. Last week, the U.S. Department of Health and Human Services announced it was going to try to create a national autism database. This project would give government access to data and medical records of Medicare and Medicaid enrollees that have been diagnosed with autism. So what step did Governor Pritzker take in response?
Well, almost immediately, the governor issued an executive order putting the brakes on that, at least as far as Illinois is concerned, basically saying that state agencies are not to hand over or collect data for this federal database or turn data over to the federal government unless it's medically or legally necessary. I think there's a lot of concern about how the federal government's going to use this data, what it's there for, what their plans are. This is something that may get worked out in the future or it may not. But Governor Pritzker is saying that this is to protect patient privacy to prevent this data from going farther than it needs to go. So that's as much as we know at this point.
Well, Peter, I want to end today on a more positive story, and what better way to do that than outside? Last year, there were more visitors to Illinois state parks than any point in the last 15 years. What's behind this growth?
Well, that is interesting, and also, kind of exciting. I personally enjoy going out to state parks myself. There seem to be a lot of things behind it. One, I think, is that as the pandemic went away and people, got back into the habit of going outdoors and going out and doing things in public, it just got to be more popular. The state has also spent a considerable amount of money making improvements and refurbishing some state parks. The most popular state park in Illinois, no surprise, is the one in northern Illinois, and I'm forgetting the name, with the canyons.
Oh, I got you. Starved Rock,
Yeah,
right by us.
Starved Rock. Yeah. And then there's also some beach property up in north of Chicago. Zion State Park, I think, is what it's called. It's undeveloped, kind of pristine beachfront there along Lake Michigan. Those are very popular. There are also a lot of popular state parks in southern Illinois and central Illinois. And it's just, a nice, affordable thing for individuals and families to do, is to get outdoors on a weekend, or, if you're taking some time off in the summer, sort of a day trip out to natural resources in Illinois that people can enjoy. It's a fun thing to do.
Absolutely. Peter, thank you so much for your time today and for all of your reporting.
Sure. Thank you.
And as always, all of our political reporting for both sides of the river compiled at WQAD.com. Just click on the As Seen on TV tab at the top of the homepage. James?